Joining me now is Theresa Adams, certified athletic trainer with the Jacksonville Orthopedic Institute. Theresa, thanks for being here.
No problem, Mark.
Last time we spoke with you, we were talking about fall sports and football and those types of injuries. Of course, at Jacksonville Orthopedic Institute, it never stops. You guys just transition into different sports, and
you're right.
I'm sure with these sports, going in winter and spring, their injuries are probably a little different.
Yeah, they are. In football, we have one game a week. I mean, it is equipment intensive, so there are acute, sudden emergency injuries. But unlike that, in the springtime, we have so many overuse, chronic injuries just from that endurance, the repetition, a lot of overhead athletes between baseball and softball.
Well, and it seems like today, too, especially with baseball comes to mind, and even soccer, too, but some of these kids are playing baseball year-round.
They are. They go from off-season club games, so in the summertime, even into fall ball. They're training off-season for their school sports, and then spring comes around, they're doing, 3 to 4 games a week on top of still continuing with their full training. What
do you recommend if you're playing that much? Is there anything preventative you can kind of do? And tell me some of the more common injuries that you see.
Preventative-wise, I would say flexibility is huge. Just doing a normal maintenance program of maintaining your strength and maintaining your flexibility by doing some stretching, getting in with a strength coach for off-season training, but also icing is crucial for injury prevention and maintenance. If you have a bump or a bruise, some acute swelling, icing it down or following up with your athletic trainer if it's a minor injury so that you're not getting down the road to a severe long-term chronic illness.
What about more common injuries that you'll see, for instance, baseball?
A lot of shoulders, a lot of just overhead, a lot of throwing mechanics if they're pitching. If they have changes to that, you can start to see a lot of elbow injury. You're going to have ligament sprains that down the road just aren't treatable with just standard ice and rest. That's when you need to look into utilizing your athletic trainer.
I know we hear on the news a lot of times Tommy John surgery.
Yep.
What is Tommy John surgery?
Tommy John. So Tommy John's is the ulnar collateral ligament. It's a ligament on the inside of the elbow. That's to stabilize the arm when you're throwing overhead. So a lot of the force that you're transferring from the ball and your throwing mechanics is going to be onto the elbow. So we want to make sure that that ligament is stable enough. What happens is if your elbow starts to lead or you're making alterations in that can cause more damage to the elbow versus the shoulder, that's going to stretch that ligament to where there is no repair except surgical reconstruction.
Anything you can do to try to prevent that? Or
look at it, your mechanics, having a good pitching coach, making sure that, as you're young, you're icing, you're maintaining your overhead endurance, making sure that if any ache and pain, that you're getting that treatment, that you're not throwing through those pains to cause you any of that injury down the road.
I guess the big thing is if you think you may have something or you feel something coming on, you got to get it looked into immediately.
Absolutely, because the whole arm, with a lot of baseball pitchers, it's not just shoulder, it can be elbow, it can even be wrist and to forearm muscles. So really it's just definitely maintenance with the overhead use, where they're pitching 3 games a week, multiple innings, so that's a lot of repetition, more than a major league baseball game would be. So.
Well, thanks for being here, Theresa. And if you guys are watching, if you're having anything that you feel is not quite right, make sure to get to the Jacksonville Orthopedic Institute and they'll keep you in the game.
Absolutely. Reach out to your athletic trainer and then we could utilize our resources down the road if we need.
Thank you.
No problem.